In chapter 14, we're going to start our next section looking at different nutritional needs at different stages of life. So starting first with pregnancy and breastfeeding, and then we'll move on to other age groups. So our learning outcomes are looking at how nutrition affects fertility, just getting pregnant, then during pregnancy, some optimal ranges, some health needs, as well as some exercise during pregnancy, and then essentially moving then into the breastfeeding advantages of doing that, some differences between breast milk and human milk or cow's milk. And so just talking about the different nutritional needs during this stage. So first of all, looking at nutrition and fertility. So women often don't suspect that they're pregnant within the first couple weeks. So infertility occurs in about 15% of those planning. And that is defined as the inability to conceive after 1 year of unprotected intercourse. The nutritional state of both the mother and father can actually affect the likelihood of conception. And there is that link between nutrition status and fertility. So there's a role that fats, carbs, antioxidants, B vitamins, zinc, and iron play in fertility. Right, so that energy balance, which is calories coming in versus calories going out. So if there is an imbalance in that, it can impair fertility. So there may not be enough energy to produce reproductive hormones. A menstrual cycle is needed. Also, though, enough calories for pregnancy and breastfeeding. These are all important stages to ensure that we're getting a positive or at least a neutral energy balance. So many underweight women don't have a menstrual cycle, so that in amenorrhea, when athletes also fall under this category. And then the adipose tissues in the ovaries are what produce estrogen, but again, they need energy to do that. So if there's a negative energy balance and there's a low body fat, then there's less estrogen that's being made. And this can be just because, again, an eating disorder, athletic training, or just lack of food availability. So during famines, for example, birth rates decline by about 50%. And again, that's due to mainly to the nutritional status. For men, low body fat actually decreases not only sperm sex drive, but also their sperm count. That obviously affects fertility. But then the opposite is true too. So too much body fat also decreases. So again, maintaining that neutral energy balance. So individuals are neither under or overweight. Now, hormonal balance, there's a condition called PCOS, polycystic ovarian syndrome. This is a hormonal imbalance in which tiny cysts, hence the name polymini, cysts form around the ovaries. And that's one of the leading causes of female infertility, and some things that can occur. So irregular or absent periods, again, difficulty becoming pregnant, and then higher than average spontaneous abortions. So losing about 5 to 10% body weight can improve the chances of conception in those cases. Also, high testosterone can occur that leads to this, or it can be caused by this. So again, excessive hair growth on the face, acne, depositing fat around the waist. Individuals can become insulin resistant, so their chance of type 2 diabetes, high blood pressure, cardiovascular disease increases as a side effect of PCOS. Low glycemic index can improve that fertility for women with PCOS. Now, if we look at some of the important nutrients, so like vitamins and antioxidants, actually consuming supplements like multivitamin, minerals, and mineral supplements are linked to improved fertility, especially folate we talked about before with our vitamins. This one's key for both men and women. This is the one that can lead to spina bifida and other neural tube issues. So consuming enough folate is important. It also, though, helps with DNA synthesis, metabolism, to ensure that there is proper nutrition. And we can get that from those green leafy vegetables, fortified breakfast cereals. Again, we've covered those before with our vitamins. Antioxidants also have been shown to improve fertility in both men and women, especially vitamin E and C, selenium, zinc, and others. And those come from those brightly colored fruits and vegetables, whole grains, and plant oils. Looking at some of the roles of minerals, so iron and zinc have a link to fertility. So for women, both of them are needed for normal ovulation. So that iron intake before conception improves the function of ovulation to improve better fertility. Now, zinc has an important role in male fertility because this is needed for sexual maturation. So those supplements may improve sperm quality in individuals who are lacking it. But again, just needing to meet that recommended daily allowance. Then our dietary fats. So of course, with anything, we want to limit this to the saturated and trans fats. We want to mainly consume unsaturated, which are more of the oils. So women with high intake of saturated and trans, that promotes insulin resistance and can impair ovulation. Of course, that impacts fertility. In men, it decreases their sperm quality. So just some examples, replacing the pizza and the fast food, kind of greasy foods with plant and fish oils to increase those unsaturated fatty acids. Also for men, it's recommended to increase the omega-3, again, mainly fish oils there to improve that sperm quality. Looking now at the impacts of alcohol. So the research indicates that there's no clear relationship between alcohol consumption and fertility. However, because many women don't know they're pregnant until several weeks after conception, and we'll learn a little later that's an important period in development. So it is recommended and prudent for women who are trying to conceive to avoid alcohol, less so to the impact on fertility, more on the impact it could have on the fetus. So again, those devastating effects of alcohol can occur, as we'll mention later in this talk. All right, so now after conception and fertility has occurred, looking at that prenatal growth and development. So a normal pregnancy takes about 38 to 42 weeks. Of course, they're divided into trimesters, so 3 periods. 8 weeks after conception, the embryo has developed from that fertilized ovum into the fetal stage or the fetus. The placenta, which is that organ that forms in the uterus that accommodates the growth and development of the fetus, essentially a little home for the fetus. It exchanges nutrients, oxygen, and other gases between the mom and the fetus, and also eliminates waste from the fetus. So looking first at that early growth, this is the first trimester is an incredibly critical time. So just to kind of put some dates or times here, actually within the first 30 hours, about a day, the zygote, which is just the egg and sperm coming together, it divides in half to form 2 cells. Then by 4 days, that number is up to about 128. After 14 days, it is now a big enough group of cells to be classified as an embryo. And then 35 days, so just around a month after conception, the heart is actually beating. The embryo, about 8 millimeters long, eyes and limb buds are clearly visible. Then at 8 weeks, that embryo is now known as the fetus. And then at 13 weeks, that's the end of that first trimester, and most of the organs are formed and the fetus can now move. So again, because of all the organ formation, this is when nutrition and especially avoiding alcohol and anything else that could damage the fetus is extremely important. Just a quick little aside, test questions are not going to involve specifics as far as the 30 hours or 4 days or the number of cells or anything like that. But definitely being able to understand the progression, how long the trimester is, again, the most critical periods, that type of thing. This is just showing, again, the relationship, the placenta, again, that nice little sac that the fetus will grow in, provides the nutrients, gets rid of waste, is very important to providing all of those nutrients and those gases. All right, so again, that critical time here in the first trimester. So essential nutrition is, if it's not available, the fetus may be affected before there's any evidence of a nutrient deficiency in the mom. So the fetus will be impacted much faster than what the mom would be. So there's quality over quantity as far as nutritional intake during that first trimester. So again, those nutrient dense forms where we get a lot of nutrients from those calories. And the mom should consume about the same amount of calories. Again, this embryo to the fetus is extremely small. It doesn't have, major energy needs. So there's no reason to increase calories. But again, sticking with those nutrient dense foods. Looking at the harmful effects, unfortunately, of those toxic agents, this is when it is the most significant. So that first trimester, you can see all of the changes, again, from that zygote that's divided to 2 cells. We have our embryo that's developing eyes and those limb buds, and then ultimately developing into the fetus there by week 8. Starting to develop all of its organs, and then by week 13, again, into the first trimester, but all of those organs have been made. So many, many changes happening from this fertilized cell through the end of the trimester. So that's when those toxic agents are so harmful to the growing fetus. I'm just looking at these, again, kind of another way of putting it in perspective. So the purple shading here is indicating where the greatest risk to that organ. So starting with like the CNS, the heart, the limbs, the eyes. As you can see, the most significant, greatest risk is all like major abnormalities occur within that first trimester. So whereas the white bars that are more over to the right, that's the damage to the vital organs that occur in later months, so after that first trimester. But again, you can see the significance and the importance of that first trimester regarding nutrients in preventing and staying away from any toxic agents that could damage the fetus. Now, during the second trimester, again, this is after 13 weeks, we're up to about an ounce. Again, I'm not going to ask about the size, but now again, starting to actually look more like an infant, still susceptible to those, again, just not quite as much, but actually the mom's already preparing for lactation and the production of milk. So there's a deposit of about 2 to 4 pounds of fat in the breast tissue, so usually a lot of breast tenderness. So nutritional deficiencies during that time can impact the mom's ability to breastfeed if adequate fat tissue is not laid down. Now, during the third trimester, this is where the fetus is really growing. So it's kind of has all the important parts there, but this is where it actually doubles in length and it increases in size or weight about 3 to 4 times. So during this last month, there's that transfer of fat, calcium, and iron from the mom to the fetus. We mentioned before, whenever we talked about calcium and iron, so preterm or preemie babies, they may need some of these supplements because, again, the mom hasn't had a chance to transfer those. And just a full-term fetus averages 7 to 9 pounds and about 20 inches long. So a successful pregnancy, the goal, of course, optimal health for both the mom and the baby. So for the mom to stay in physical and emotional health remains intact. For the infant, the goal is to get past 37 weeks. Again, it's amazing the advances that there are in the success of preterm or preemie babies to survive. But again, there are typically some delays, some impacts ultimately. So getting to that 37 week is always the goal. mainly the lung development. A lot of times, if individuals, if moms are having problems and they think the baby may come early, they typically try to give a steroid to increase the lung development. So again, just the longer the gestation, the less chances, doesn't mean nothing bad can happen, but just the less chance of a health risk. And then the goal as far as weight is greater than 5.5 pounds. So we want to get to 37 weeks and we want the baby to be about 5.5 pounds. So exposure to those toxic chemicals, again, of course, eliminating alcohol, tobacco, and illicit drugs, because these can cause those malformations because they all cross the placenta and affect the fetus more so than what they impact the mom. Marijuana is actually the most common recreational drug that's still used during those reproductive years. And it actually reduces blood flow to the uterus and placenta that can impact growth and development. Being careful of prescribed and over-the-counter medicines, just because they're over-the-counter does not mean they should be used while pregnant. So there's a lot of information out there to find out what is and is not safe. Herbal therapies that don't require any kind of regulation, they can be potentially damaging. So just because something doesn't have to be prescribed doesn't mean that it can't be dangerous. And then any type of job-related hazards or x-rays, avoiding those is important during pregnancy. Now, foods can also be a potential cause for concern. We mentioned listeria before in chapter 12, our last chapter. This is one of those foodborne illnesses. It's a bacteria, but again, the danger comes to those pregnant women especially. It causes those flu-like symptoms, but it can lead to a spontaneous abortion. So staying away from unpasteurized milk, so like soft cheeses, anything made from raw milk that's not been pasteurized, even raw vegetables. So again, cooking, consuming, staying away from deli meat, again, is another one that's important there as well. So limiting exposure or chances of being exposed to that bacteria. All right, now looking at that pregnancy body mass index. Again, this is relating height and weight. So of course, aiming for a healthy body weight is we always should be. Infants born to either extreme over or underweight are more likely to have problems that vary. Obese women, for example, the infant has an increased risk of birth defects, death earlier in life, and obesity during childhood. The impacts of being underweight, so under that 12 or 18.5, more likely to have a low birth weight and be premature, lower nutrient stores, especially of iron. So again, better outcomes are whenever there's weight gain before and during pregnancy. Looking kind of overall at the nutritional status, so good nutrition is worth the effort to improve the outcome and prevent birth defects. Calories should not be restricted during pregnancy. For example, 1,000 kilocalorie day greatly restricts growth and development. So consuming, sufficient amounts of calories more than the 1,000, getting enough folate to prevent birth defects like those neural tube defects like spina bifida, and also decreases preterm delivery. And then some causes for concern. Again, not getting enough calcium and an iron, or excessive amounts of vitamin A. So that's one of the fat-soluble vitamins, so it can actually be damaging to have too much of it. Okay, then just kind of looking by trimester as far as the estimated energy requirements or calorie needs. So again, during that first trimester, additional calories are not needed because, again, we're talking about cells and normal nutrition is sufficient there. Now, during the second, this is where we start adding on. So adding on about 340. And then actually the most increase in calories needs to come in that third trimester because, again, as we mentioned, the fetus is, doubling in length. It's, increasing its size. It's just growing at infinite rates there. So having proper nutrition is very important in that third trimester. So again, just balanced, adequate diet in the first trimester. Then the second and third, again, increasing the micronutrients. So those are like the vitamins and the minerals during that time by about 50%. Calories, though, only need to increase by about 20%. So choosing those nutrient-dense foods. So you're getting lots of vitamins, lots of minerals, but not necessarily increasing the total calories that much. So just another part is staying active during pregnancy. So it's recommended to perform at least 30 minutes a day of moderate intensity. So, shouldn't be doing high intensity exercises, but moderate intensity, again, walking, even swimming are good activities. Having enough fluid before, during, and after physical activity to stay hydrated. That's just going to keep the body temperature regulated. That's why we don't want high intensity. We don't want to over exert that body temperature. Heat stress can be harmful. So again, not getting to the point of exhaustion. So in total per week, about 150 minutes, again, of moderate intensity. Then high-risk pregnancies should, though, restrict or may need to restrict. So if you're put on bed rest, then obviously the 150 minutes goes out the window. So again, your healthcare provider, though, is the best source for providing those recommendations. So the benefits of physical activity are not just for the baby. So there are impacts for the mom, prevents excessive weight gain, improves, heart function, decreases the risk of gestational diabetes or hypertension, reduces bone loss, because again, calcium levels, that fetus is going to take what it needs at the mom's expense. Essentially, it's a parasite getting what it needs, however it can. Decreases swelling or edema, sleeping better, decreasing back pain, and just, that psychological improved satisfaction with body image. Now for the baby, the impacts is it decreases the resting heart rate, so it doesn't get overexerted. The placenta is healthier, more amniotic fluid to cushion the baby, improves brain development, ensures a longer gestation, so decreases the chance of preterm pregnancy. And then even after birth, it's likely to have a lower birth weight so that the fetus isn't overweight, and also a leaner body mass index during childhood. So optimal weight gain is about 2 to 4 pounds during that first trimester. So not a lot. Again, we're not really increasing calories yet. So just a little bit of weight gain. And then during the second and third trimesters, about a pound per week. And that average birth weight is about 7.5 pounds. Again, at least want to get to 5.5, 5.5 pounds, but the average is about 7.5. So that total weight gain goal is about 25 to 35 pounds for those who are normal weight, so between 18.5 and 24 or almost 25. If carrying twins, though, then that needs to increase to about 37 to 54 pounds being gained during pregnancy. All right, so what actually leads to that weight gain? Again, the goal was 25 to 35 pounds. So the various components make up about 25 pounds. So the fetus, the placenta, and the amniotic fluid make up 11 pounds. The fetus itself, again, about 7.5 to 8 pounds. We increase our blood by 4 pounds. The uterus and our breasts, due to the extra fat deposit, is about 6 pounds. And then increasing those fat stores is anywhere to 4 to 8. So again, that 25 pounds is needed in order to support all of that development that's occurring. Now that 25 to 35, again, that's assuming that there's a normal BMI at the beginning. Individuals who have a low BMI, who are underweight, they need to increase that poundage a little bit from around 28 to 40. If the individuals are overweight, then they only need to consume 15 or increase 15 to 25 pounds. And then if the individual is obese, the recommended weight gain is only 11 to 20 pounds. So again, the 25 to 30 is based on a normal BMI, and that's adjusted if that BMI is higher or lower. Now, in addition to getting, the proper carbs, proteins, and fats, it's also somewhat common to add a vitamin and mineral supplement, especially if that was a problem before pregnancy. Then those supplements are continued or maybe even enhanced during pregnancy. All pregnant women should take folic acid or folate supplements to ensure proper amounts of folate for that neural tube closure and preventing preterm labor. But some also need an iron supplement. Multivitamins and mineral supplements may also be needed just to decrease low birth weight or small gestational age births. So these are recommended for individuals, especially those living in poverty that likely don't consume enough foods, teenagers, anyone with an inadequate diet for whatever reason, having twins or multiple fetuses, smoking or alcohol use or irregular or illegal drugs, and also for vegans, which we'll talk about next. Looking at my plate for meal planning during pregnancy, so with the fruits, at least 1 cup should ensure proper vitamin C of those 2 cups that are recommended. For normal vegetables, we want to make sure 1 cup has those green vegetables or, again, rich sources of folate. Our grains should include whole grains and enriched foods, so like ready-to-eat cereals, that type of thing, to ensure those vitamins and minerals are present. For the proteins, again, those are needed to provide the extra iron and zinc needed during pregnancy. Then dairy, choosing low-fat or fat-free versions are good to supply that calcium, proteins, and that vitamin D. Right now, for the pregnant vegetarians, the lacto-ovo-vegetarians or lacto-vegetarians, these individuals typically meet their nutritional needs. So those who still usually eat chicken or lactose, so dairy products. And again, same kind of concerns as the non-vegetarian. So vitamin B6, iron, folate, and zinc. So ensuring those, which is the same for non-vegetarians. Where the issue comes in are those that are strict vegans, so not consuming milk or any type of meat. So these will require sufficient protein. Again, focusing on that vitamin D, the B12, the iron and zinc that's in all of them, calcium, and those omega-3 fatty acids that they would be missing from not having enough protein. So those prenatal supplements may be necessary to meet all of those.